Hi everybody, I'm Dr. Tracy Papa. I'm a high-risk OB specialist in Fort Worth, Texas. If you're looking for information about your pregnancy, whether you have a high-risk pregnancy or just a high-maintenance pregnancy, or if you've got any questions, this is the place to be.
If this is helpful to you and you like what you're seeing, subscribe to the channel and turn on your notifications so you'll be the first to know when something new comes out. Today we're going to talk about life after diabetes in pregnancy. If you have had diabetes in your pregnancy, whether you started the pregnancy with diabetes or became diabetic during the pregnancy, there's a better than even chance that this is something you're going to have to deal with after the pregnancy is over. Up to 60 to 70% of women who have diabetes in pregnancy go on to become diabetic, or they just stay diabetic. So after you have your baby, here's what's going to happen. One of the first things you're going to notice is that your glucose has come down immediately. Maybe not completely down to normal, but you're going to notice a change almost immediately after the baby is born. So different providers manage your glucoses after the baby comes in different ways in the first few days after delivery. Usually what we want to do is keep checking your glucoses first thing in the morning and 2 hours after your meals for at least a few days to see where these are going to settle out. Many times your glucoses will come to normal right away, and if that's the case, you can breathe a little sigh of relief. You can eat some pie or whatever it is that you've been craving and depriving yourself of during the pregnancy, and then make up your mind to get back to work because you may not be done yet. Next, you may notice that your glucose has come down, but maybe not completely back to normal. So whether your glucoses are a little elevated or whether they're back to normal, you have to remember that your risk is still there. So one of the things we do after you have the baby is to repeat your glucola test if you have had gestational diabetes. We usually wait till you're at least a few weeks out from your delivery to give you the best chance of passing the test. And then we do a 2-hour glucose test, which means we get a fasting glucose, we give you 75 grams of glucola to drink, and we test your glucose 1 hour and 2 hours after you drink your glucola. If any one of those values are abnormal, then my friend, you have diabetes. The other option is you pass that test and you don't have diabetes, but wait, you're still not done, because if you pass your glucose test after you have your baby, you have to remember that your lifetime risk is still elevated. So you don't need to eat as strictly as you were when you're pregnant, but you do need to stay active. You do need to follow a basic low carb, high protein, lots of vegetables and fiber diet. And every year you need to go to your primary care provider and have a test drawn called a hemoglobin A1C. And that looks at what your average glucose has been over about a 3-month period of time. Don't have a primary care provider, you need to find one. For many women who don't have a primary care provider per se, their OB/GYN provider is their primary care provider, and they can do this test for you every year. Remember that diabetes can be very sneaky and it can creep up on you without causing any symptoms at all. So you have to stay on top of this and be aware and keep checking every year. And if your A1C is going up from the normal to the pre-diabetic or even the diabetic range, then you got to get busy again. I always tell people that the best way to not be diabetic is to pretend that you are. In other words, if you're eating the right things and if you're staying active and if you're following a healthy lifestyle, that's the best way to not be diabetic. And this is what we ask diabetic people to do. So you have options available to you after you have the baby that may not have been options while you were pregnant. So there are different medication options depending on whether or not you're breastfeeding, but the best, really the only true way to treat and cure type 2 diabetes is really intentional dietary management. Remember that to keep your glucoses low and to keep your body from storing glucose as fat, you have to lower your insulin production. And the way to do that and become more insulin sensitive is to not give your body a lot of carbohydrates or starchy stuff or glucose. So that means push the protein and the healthy fats and the fiber and the leafy green vegetables, and limit potatoes, rice, bread, what am I leaving out? Pasta. That's a big one. So reduce those portions and eat them last, just like you've been doing when you're pregnant. This is a dietary approach called low carb, healthy fat diet. And we've been taught since the 1980s to lower fat in our diet, and we've actually done that. If you look at graphs of what our fat intake is since about 1980, we can see that it has gone steadily down. And what should have followed is that our obesity rate should also have declined. Surprisingly, or not so surprisingly when you know what's going on, that hasn't been the case. We've lowered our fat and our obesity rate is higher than ever. So limiting fat doesn't necessarily lower your cholesterol, and it doesn't reduce your risk of obesity. It's the carbs that are going to kill you. So you have to lower the starchy foods, and remember that simple sugars, the things that are broken down or not pre-digested, but processed foods don't have a lot of fiber in them, and they don't have a lot of complex carbohydrates. So instant rice, instant oatmeal, all of these instant mashed potatoes are nothing but the starch. So they have a higher glycemic index than table sugar. So you've got to really watch that stuff and push the things that are not going to affect your glucose as much. These are healthy fats, nuts, avocados, things like that, coconut oil to cook with, and lots of protein in your diet, or a moderate amount of protein. Eat plenty of meat if you're not a vegetarian, and fish and eggs. Those are the things that are going to keep your glucoses from bouncing around too much. So the same principles apply as when you were pregnant, but the new things that you might be able to work with are things like intermittent fasting. This is not such a good idea in pregnancy because your metabolism is different and it uses up carbohydrates and calories a little bit faster. After you have the baby, even if you're nursing, missing a meal is not going to kill you as long as you're staying very well hydrated. So sometimes reducing your feeding window, instead of eating 3 meals and 3 snacks every day, limiting yourself to 2 meals or 3 meals and extending the amount of time between meals, like nothing between dinner one day and maybe lunch the next day. These things help lower your insulin level, and that in turn helps make you more insulin sensitive, and that is going to lower your blood sugars. Don't forget to make healthy movement a part of your everyday routine. At least 30 minutes a day, every single day if you can do it. You don't have to go to the gym. You don't have to have any special equipment. If you can get out and walk with your baby every single day, or walk the dog, or just get out for your mental health, if you can do this for 10 or 20 or 30 minutes every day, you're going to lower your risk somewhat. And also remember that weight bearing is important. If you add muscle burns more fat than other tissue does. So even if you put on a few pounds of muscle, it's going to be much more efficient at burning fat, and that's going to help your metabolism. A word about future pregnancies. If you have had diabetes with one pregnancy, you're much more at risk for having it again with another pregnancy. So one of the things you're going to want to do before you plan another pregnancy is to try to reach and maintain your ideal weight. If you started out this pregnancy over your ideal weight, or if you gained a lot of weight with the pregnancy, before you have another baby, try to work on that. And if you are diabetic after pregnancy, if you can get your A1C down to 6 or below, you're going to have a much better chance of not having gestational diabetes with a future pregnancy. But also remember that if you have diabetes or elevated blood glucoses going into a pregnancy, the risk is higher for birth defects for baby and health problems for yourself. So get healthy before you have another baby. To wrap this all up and tie a bow, your body has served you really well with this pregnancy. It hasn't failed you. It has done a fantastic job. And now here you are with your baby. You want to love your body. You want to take care of yourself. And remember that diabetes is potentially reversible. You just got to keep behaving the way a diabetic should. So as a general rule, not 100% of the time, but most of the time, you want to eat healthy and you want to focus on healthy fats and proteins and limit the amount of starchy foods that you have. And remember that anytime you want to, you can take a break. You can have a food that you enjoy. You can kind of break out a little bit. Just don't make it a habit. These foods are special because they're only every now and then foods. If you eat them every day, they kind of lose their appeal. So stick to just once a week or once a month, and that way those foods stay really special and you really enjoy them more if you know you've worked for them. So just remember, you've got this. You've been strong all through your pregnancy. You may have slipped up a few times, as do we all, but you've totally got this, and you're going to do a great job as a mom. I know it. If you like what you're seeing and you feel like this is helpful, turn on your notifications, subscribe to the channel, and you'll keep getting more.